Every single day, all around the world, new lives begin. And in those very first moments, there's this incredible science at work. It's a science that's always changing, always getting smarter, and always learning how to better protect newborns when they are at their absolute most vulnerable. I mean, that journey from the womb into the world, it's probably the most dangerous trip any of us will ever take. And those first 60 seconds, they can literally set the course for an entire life. For the medical teams in that room, it is a minute of pure, intense focus. So that's the big question, right? We know so much more today than we ever have about that first breath, that first cry, that first minute. So how has all that new knowledge actually changed the way we care for a brand new human being? Well, a huge part of the answer is in this thing called the Neonatal Resuscitation Program, or NRP for short. You can think of it as the world's official instruction manual for this stuff, used by doctors and nurses everywhere. And it just got a massive update, the 9th edition, and it's packed with new research. So today, we're going to break down the biggest changes. Okay, this is the playbook, the NRP algorithm. Now I know, it looks super complex, but it's actually this beautifully logical flowchart. Every box is an action, every diamond is a decision. It's the map that guides the team through that critical first minute. And this map is what's just been updated. So the first big theme you'll see in these updates is all about a gentler welcome into the world. It's this idea that sometimes less is more. Doing less but doing it more thoughtfully can actually be a huge benefit for the baby. And that gentler approach starts right away with the umbilical cord. This lifeline has been the focus of so much research, and these new guidelines really show a big shift in how we think about its job right after birth. Take a look at this. The change seems subtle, but it's huge. The old 8th edition said to wait 30 to 60 seconds. The new 9th edition? It's much clearer, at least 60 seconds. It's a few extra words, but it represents a major change in standard practice. So, why does that extra time matter so much? Well, in that final minute, the placenta sends this incredible last-minute transfer of iron-rich blood to the baby. It's like a bonus infusion that helps protect against anemia and improves outcomes down the line. The science on this is just crystal clear now. And this whole less is more idea keeps going. In the old algorithm on the left, you see the step included suction if needed. But in the new one on the right, that phrase is just gone from the routine first steps. It's been taken out on purpose. And why? Because the data showed it just wasn't necessary for most babies. A big study found that being more selective about it caused no harm. For babies born with clear fluid, routine suctioning wasn't really helping. So the new philosophy is simple. Don't intervene unless you actually suspect a problem. Okay, the next set of changes is all about breathing. That first breath is everything, and the science of how to support it has become incredibly specific. We're moving away from a one-size-fits-all method to something way more personalized. For instance, look at the starting oxygen concentration. It used to be this broad range for any premature baby under 35 weeks. Now, it's broken down into these really specific categories based on exactly how premature the baby is. It's a much more tailored, precise way to start. Think of a newborn's lungs like a brand new, super delicate balloon. That very first breath has to have just the right amount of pressure. Not enough, and the lungs don't open. Too much, and you could cause damage. So the new guidelines reflect that, moving from a general range to a more precise starting pressure based on the baby's size. This change to the ventilation rate is also really important. The new range of 30 to 60 breaths a minute is a better match for how a newborn naturally breathes. But just as crucial, it lines up perfectly with chest compressions if they're needed, which are done at a rate of 30 breaths a minute. It just makes the whole process work together more smoothly. Oh, and this is a great example of the guidelines finally catching up to reality. You know that little device that measures oxygen in the blood? It can take a good 20 or 30 seconds to get a stable reading on a newborn. So that old 1-minute target was often based on shaky data. By starting the clock at 2 minutes, the guidelines are now built on information that's way more reliable. Now, this evolving science isn't just about what you do, it's also about the tools you use. And the new guidelines show some really cool advancements in the equipment that helps save these little lives. So meet the laryngeal mask airway, or LMA. This thing has been around, but it just got a major promotion in the playbook for newborn care. It's a really powerful tool for helping a baby breathe. Here's the big change. The LMA has gone from being a backup, rescue device to a primary option. And that's because study after study has shown it just works really, really well. A lot of the time, it's actually faster and more effective than trying over and over again with a face mask or even trying to place a breathing tube.
Speaking of breathing tubes, getting the size right is everything. Just look at this comparison. The old guidelines on the left had, 3 broad categories for sizing. The new ones on the right have 5, much more specific categories based on the baby's weight and age.
And why does that much precision matter? Because new data showed that the old tables often made people choose a tube that was too big. An oversized tube can cause serious injury to a newborn's tiny airway. These new, tailored sizes are based on better data, and that leads directly to safer procedures for these incredibly fragile patients. So when you put all of these pieces together, delaying the cord clamp, tailoring the breathing support, using smarter tools, a really clear picture starts to form. The science of saving lives is never finished. It's always learning, always refining, and always getting better. And if there's one single philosophy that sums up this entire update, it's this right here. Every single change we've looked at today was made not because that's how we've always done it, but because solid new evidence proved it was a better, safer way. It really makes you wonder, doesn't it? If this is how much we've learned in just the past few years, what else don't we know yet? What amazing new insights will the next edition of this playbook have, and how will it keep changing the science of that very first minute?